So Dr. Geelani, my next question is to you. When somebody suffers from chest pain, somebody has an attack of chest pain at home, what should the family members do in such a situation? It's difficult for lay people to distinguish between an innocuous chest pain or chest pain, which is actually angina. So what should they do? What kind of measures can they take in such a situation?
The first thing, the relatives and the patient, I would suggest to the patient and relative both, they should not panic.
Right.
Because this is not a disease which is not treatable, which cannot be cured. So they should not panic. That is one. Second thing, they have to identify whether they are really having the heart problem or it is some other thing. So they should know the typical presentation, like the chest pain on the left side. If it is, the pain is radiating, it is coming to the arm, it is going to the neck, and but even they are having palpitation or they are having perspiration. So
Right.
they should think, yes, they may have the heart attack, and they have to treat in that, they should be treated in that direction.
Right.
Like the gas problem, what if, like Dr. Vinod has already mentioned that the people who say it is a gas problem, but we have to identify if the person has not has not gone for dinner somewhere, he has not taken spicy food on that day, or this gas problem was not earlier there but has happened first time, then they should think it is not most likely because of the gas problem and other gastric reason, and this pain we have to rule out whether the patient is having the cardiac problem or not.
Right.
So in that situation, what is suggested, that the patient should go and get the ECG done, because it may be available in the nearby places.
Right.
And the person should know whether the pain is persisting or not. If the pain is persisting beyond 1 hour, they should not wait at home. They should go and get the ECG done. If the ECG shows some changes, then obviously they have to go. If the ECG is not showing any changes, then they have to be a bit relieved that most probably they are not having the cardiac problem. But still there is chances, a small percentage of the people may have the non-ST changes. Means the ECG will not show any change, but the patient may be having the heart attack. So that in that situation, if the pain persists beyond 2 hours, ECG is normal, then also they should go and they should get their blood, like enzyme tests done, so that will rule out whether the patient is having the cardiac problem or not. The importance of the 1 hour, 2 hour is that we should not waste time, because if the heart attack occurs, the blood supply to the part of the muscle of the heart is not adequate, so the patient will die if it is not treated within 6 hours. So the 6 hours period is there. So 1 or 2 hours you are wasting in the diagnosis. So still you have the 4 hours, you can go to the hospital and get the needful done if it is a heart attack. So this is the importance. And if it is beyond 6 hours, then this damage becomes irreparable. We cannot do anything with that, and the nature will take care of them. So this 6 hours period is very important. So they should wait for a 1 hour, and certainly not beyond 2 hours if the pain is continuous and it is persisting, or it is, even if it is increasing if it is increasing in severity.
Right.
And this thing was more true about the diabetic patient, because the diabetic patient may not have the mild pain, they will ignore it. It will not present, because most of the silent MIs are usually present in the diabetic patient. So in the diabetes, this is not a very clear, but means it is not a very clear indication if the patient is having a. But if suddenly if there is a chest pain and it is typical type, then they should report to the hospital.
Right. As you said, sir, time is crucial, and people who are more prone to certain risk factors and hence more likely to develop CAD, they should be more watchful, and even symptoms which look innocuous should be investigated, and they can undergo an ECG as well as the blood test that you specified.